start with the race to contain the hantavirus, where 18 American passengers who had been aboard the MV Hondius, they are back in the United States today after an outbreak of the virus on board the cruise ship sent health officials worldwide scrambling. The ship has been linked to 3 deaths and as many as 9 suspected infections. And according to health officials, 16 passengers from that ship, they were taken to the National Quarantine Unit at the University of Nebraska Medical Center in Omaha this morning. One passenger who tested mildly positive for the virus is now in a biocontainment unit. The other 15, they were in less restrictive quarantine units. They've been described as hotel-like. We'll talk what those are. But health officials said that the other 2 passengers, including a person with mild symptoms and that person's partner, they were sent to Emory Hospital, University Hospital in Atlanta. All 18 passengers, they're going to be monitored for the virus, which, by the way, is a complicating factor. It has a weeks-long incubation period. There's no targeted treatments or widely available vaccines. There is a rare spot of good news here because health officials said that depending on their health, some of those passengers may be able to leave the facility to finish their quarantine at home. Now, of course, there's a lot of questions about what that means. And also, I should tell you, health officials, they didn't put a time frame on when those passengers would be allowed to head home. But the caution is understandable considering the Andes virus of the Andes variant, of the hantavirus, that can be spread by person-to-person contact. That's what makes this different. And that risk of contagion is why health officials in 8 states are now monitoring, again, close to 30 people for signs of infections. And just to show you how dangerous it can be, the state of Maryland just announced it's now monitoring 2 people who weren't even on the ship. They were on a flight with an infected passenger from the MV Hondius, which shows health officials aren't taking any chances. But in spite of the climbing number of potential cases, the president doesn't seem too concerned, saying this at an event in the Oval Office earlier today.
In certain ways, very hard to spread. It's been, we've lived with it for years, many years, and we think we're in very good shape. We're very careful. And Nebraska has done a fantastic job. They have a place there that those doctors are unbelievable.
So in spite of all the uncertainty out there, is President Trump right when he says we're in, quote, very good shape when it comes to the hantavirus? Well, a lot of it's going to depend on how things go at the National Quarantine Unit in Nebraska. And earlier today, Time magazine reporter Phillip Wang spoke to Dr. Michael Ash, the CEO of Nebraska Medicine, about just how that quarantine unit operates. Interesting discussion. Phillip Wang joins us now. Thank you so much for taking the time. So what's going to happen to those passengers in their first day in this unit?
Good to join you, Jesse. So the passengers, the 16 Americans that came to Nebraska Medical Center, they will be quarantined in their center and being monitored as we speak for any of the symptoms. If any of those people display any symptoms, further testing will be conducted to make sure that the undivided strain of the hantavirus is in their bloodstream. Now, one of the 16 Americans have tested mildly positive in another country. That individual is displaying no symptoms, and they were transferred to the medical center's biocontainment units for further testing and monitoring. And the 15 asymptomatic patients who are currently negative were put in quarantine. And I will say in my conversation with the CEO, who told me that these biocontainment units as well as quarantine centers are almost like nice, secure hotel rooms. Yeah, aside from the regular medical bed, you also have exercise equipment and entertainment. And all of these meals are brought to them throughout the day. And most importantly, these units are singly insulated and maintain an air supply that is going through an advanced HEPA filter so that there is no risk of transmission between the people who are being quarantined as well as the medical staff that are taking care of them.
That's an important point for a number of reasons. I mean, look, it's a distressing situation, but at the same time, when we think of a quarantine room, this is a little bit different. When you talk about testing, how are they tested for the virus, and do you know how accurate those tests are?
So the Dr. Michael Ash, the CEO of the Nebraska Medical Center, told me that they're conducting PCR testing. These are not your regular off-the-shelf COVID testing that will tell you positive or negative. In fact, it will look into just how much virus is in your bloodstream. Now, Dr. Ash told me that it is possible that there would be virus in your bloodstream, but you don't show any symptoms. That is totally possible. It means that your immune system might be fighting off these virus. So it is a very complicated and specific testing that the Nebraska Medical Center is conducting in coordination with the CDC to make sure that these are very accurate and specific tests so that they can run throughout the day.
Do you know how long they're going to be kept there? In other words, I understand it's what, a 1 to 8 week incubation period. Are they kept there for the maximum? And do they have to be tested if they have nothing in their bloodstream? How does it work exactly? How long they might be there?
So the current protocol requires them to stay at these medical centers for 42 days. And if they don't exhibit any symptoms and their testing shows that there isn't no progressing of virus going forward, they are free to leave. But for now, it is a ongoing situation that everyone keeps getting monitored and making sure that there is no spread from where they left to the medical center. And each of the staff are also going through testing in the same way. And even the pilots and the airport staff who repatriated these Americans are also going through testing to make sure that there is no leakage of the virus.
So they're being monitored, not the pilots and the crew members, but not exactly quarantined. Did Dr. Ash say if he's concerned about the spread of this contagion?
When, it's interesting because when I asked him how confident he is about containing these viruses, he told me the medical center has the highest confidence. This is a medical center that received U.S. citizens with Ebola virus, which has much higher fatality rate back in 2014. And they also received the first U.S. citizens who tested positive for COVID-19 back in 2020. And remember, these are highly trained staff and who runs regular drills to make sure that every patient can get tested and treated properly and no virus, specifically this infectious kind, can get out of the medical center. And they have proper protocols at every step of the way to make sure that everyone can stay safe and get treated.
And just real quick, the pilots, the crew members, they're just being monitored and tested, right?
That's correct.
Okay. So we have a better idea exactly what this looks like, what they're doing at the facility, and we'll be keeping a very careful eye on communications coming out of that in terms of people who are released and how. Listen, Phillip Wang, thank you so much for taking the time. I really appreciate it.
Happy to be here.
So, for now at least, health officials seem to have the hantavirus situation in Nebraska handled, okay? But there are still 7 other states monitoring potential cases, and it seems like that number is increasing by the day. I mean, it's a very different one from what we talked about last week. So, what more can be done to limit the spread of this virus? And looking forward, what can we do to stop the spread of future diseases before they become a catastrophe? For that, I'm joined once again by Dr. Syra Madad, an infectious disease epidemiologist at the Harvard Belfer Center. Thank you so much for taking the time. Always appreciate it. So we just had this conversation. You have these passengers there in quarantine. Do you agree with the way that this is being handled right now? Do you agree with President Trump's assessment that we're in, quote, very good shape when it comes to handling the hantavirus?
Well, currently, operationally, we certainly are in good shape because these passengers couldn't be at a better facility. As you just discussed, just a couple of minutes ago, they're at Nebraska Medical Center in their quarantine unit. This is an amazing facility. I know these individuals are my colleagues. We have 13 of these elite regional Ebola and special pathogen treatment centers kind of throughout the United States. And so these are highly skilled individuals with very amazing capacity, both from a healthcare standpoint, as well as just the staffing infrastructure and the availability of additional resources. So they couldn't be in a better place. And so currently in the situation that we're in with all these Americans repatriated in this current, destination, we are in good shape.
How do you do a home quarantine?
Yeah, so home quarantine, and this is bread and butter public health. We do home quarantines all the time for various infectious diseases, and this is a highly structured process. And what this means is, depending on the type of infectious disease, the oversight from a public health standpoint includes, the public health department doing daily check-ins on this individual. Oftentimes, they're keeping a temperature log, and then they're also doing symptom monitoring. And if they become symptomatic at any point, then they connect that individual to a healthcare facility for additional additional testing as well as isolation and treatment if needed. So this is a highly coordinated process, and this is not the first time that the home quarantine has been brought up.
Here's the problem. People will look at this and say, well, okay, if they experience symptoms, then they're going to, take action. But who are they around? What are they doing if they're living their lives? You have to, again, the first Jersey plane passengers now in Maryland flying next to somebody with hantavirus. Can you please explain one more time from what we currently know? I know I always ask you this question. When we say that this is spread by close personal contact, give me, if you can provide examples of what exactly that means. If you have somebody on a plane, that means you're sitting next to them and you were talking to them, or accidentally take one of their drinks. I mean, what does that have to be for people out in the public? How concerned that we should be?
Yeah, it's an excellent question. Let me first take you back to the best example that I can give you, which is which has happened on the cruise ship. And it's not just what has happened on the cruise ship, it's the environment within it of itself. These individuals weren't just in an enclosed space. They were having constant, sustained daily contact. They were in the same restaurants, probably sharing the same, public restrooms, doing the same activities. And so they have repeated exposures to one another. And so because of that, the Andes virus, which we're dealing with, had many more opportunities of individuals coming together in these confined spaces and having exposure to one another. And that's why you're seeing more and more of these positive cases come about, which we're going to continue to see over the next few weeks. Now, that's what we talk about when we talk about Andes virus transmission, is that constant opportunity of, ongoing sustained exposure. Now, when we talk about, let's just say, measles or COVID-19, you're not going to necessarily pick up Andes virus through the casual contact unless you also have that social behavior and that social environment, like an enclosed space. And so right now, bottom line is we know how this virus spreads, but we are still learning more about it. The dynamics of transmission is something we're going to continue to learn in the weeks and days ahead. And so we may continue to change and tweak some of these guidances. But the best example is right in front of us, and we're seeing that play out in real time.
But what happens if it changes? So we talk about the incubation period, this long incubation period, the people who are being monitored, the people in quarantine. How do we know when it's safe really for them to be let out, and how do we know, exactly when they were infected, and how do we have this idea about, if the virus mutates or it changes or the transmission changes and we're playing catch up? I think those are the questions that scare people the most.
Absolutely, and those are legitimate questions because we certainly experienced the pandemic just a few years ago. So these are important questions to answer. So I think the first is we have an entire process in place to be able to understand when did an individual get exposed. This is an individual based process. This is not looking at a crowd or a group of individuals and say, okay, you know what, you're going to quarantine for 42 days starting today. That's not the case. We actually look at every single individual and we do what we call case investigation and case management. So what happens in the case investigation? You look at exposure history, you look at symptoms, their underlying health conditions, and you look at the last date that they may have been exposed. And then you start the clock of 42 days based on their last time or last date of exposure. So for each individual, that may be a little bit different. And so with the current cohort of individuals that we have, these 18 Americans that have been repatriated, their clock likely started when they disembarked, from the cruise ship and are now in Nebraska. So it's a very individualized approach, and there is a process in place.
Real quickly, about 20 seconds. If there are other diseases on the horizon, based on what we're talking about, do you feel more confident in our level of preparation?
Technology-wise, I'm confident because we have some amazing technology and we have a lot of resources, but we have less public trust and we're dismantling public health actively in this country. And so in some ways, we are better prepared, but in many other ways, we are not.
Dr. Syra Madad, always love having you on to break it down for us. Thank you so much for taking the time, and I'm sure we'll have you back on as this story develops.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.